I am Dr. Julie Zweig, and I am a specialist in the field of sleep medicine. I'm actually dual board certified in both ear, nose, and throat, as well as sleep medicine, and I've been practicing for over 20 years. So now we're going to discuss some coping strategies to help us fall asleep more quickly and also get a better quality of sleep. The first thing we want to address is our routine. Actually, routines are really good for sleeping. Our body does not like it when we change up our routine. So we want to wake up pretty much at the same time every day, and we want to actually get out of bed, get dressed, and start our day. And then we want to go to bed at a reasonable hour. The maintenance of this routine will certainly help us to keep on a really good sleep schedule, and it will help us feel better in the morning. The second thing we want to do is we want to talk about sleep hygiene. So what is sleep hygiene? Sleep hygiene is basically a number of behaviors or habits that we use to be able to fall asleep and have a very comfortable sleeping environment. So what are some examples of sleep hygiene? One thing is to have a bedroom that is very cool in temperature and also very dark. In addition, the bedroom should only be used for sleeping and sex. It should not be where you answer all of your emails on your computer in bed, or where you watch that late night TV show, or where you check the news on your computer, or everything that your friends said on Facebook right before going to sleep. Really, the bedroom should be a separate area just for sleeping. Some people also say that a weighted blanket helps them to sleep. But in my opinion, the most important thing is to have a cool environment and a very dark bedroom. Now let's talk about what to do before you try and go to sleep. Often taking a hot bath will really help your body to calm down and get you in the mood to fall asleep. We want to stay away from exercise at least 2 hours before trying to go to sleep. And we want to stay off of our electronics. As we discussed before, the electronics emit a blue light which goes directly to our brain, which then signals the brain to wake up. And that makes it very difficult to fall asleep. We also should refrain from drinking alcohol before bed, as this makes the quality of our sleep really poor. It does help us to fall asleep more quickly, but in the morning you will not feel refreshed. Another thing that may be helpful is to take some melatonin. Melatonin is actually a naturally occurring substance that our body produces that helps us to maintain our circadian rhythm and tells us when it's time to go to sleep. This melatonin can actually be found over the counter in many stores, and if you take it about 30 minutes before you're ready to go to sleep, it will help you fall asleep as well. Melatonin is not a prescription medication, and I'm not a fan of prescription medications for sleep. They can become extremely addictive and very difficult to stop using. I'd much rather use these strategies to help you improve your sleep. Another thing we want to remember is that naps during the daytime do not help us to sleep at night. Really, it's better to be a little extra tired and go to bed a little bit earlier and not take a nap. And this will help you sleep through the night and help you to feel much more refreshed in the morning. We also want to be careful about not eating right before bed. Really, you should stop eating about 3 hours before it's time to go to sleep. I do want to mention that there are a lot of other things that may make it difficult for you to sleep. One of them is called obstructive sleep apnea, where you're actually stopping breathing at night. There's some form of obstruction in your nose or throat or other areas that's making it difficult for you to breathe. You may have extreme snoring and you may actually stop breathing. We'll actually address that in other videos, but I wanted to mention that there may be some medical issues preventing you from having a good night's sleep. I want you to know that these strategies may not work for everyone. What works for one person may not exactly work for the other person. As you know, we're all individuals and we react to these things very differently. Now, if you're still having trouble sleeping, We also have psychologists who can help with cognitive behavioral therapy, or we can have people that help with biofeedback. There are other ways to deal with sleeping. But I hope that some of these strategies will actually help you to improve your ability to fall asleep and have better quality sleep. So in conclusion, I think some strategies to help us to fall asleep and have better quality sleep include having the same routine every day in terms of when you wake up and when you go to sleep, staying off those electronics, at least stopping them 2 hours before trying to go to sleep, staying away from alcohol and of course caffeine, exercising no sooner than 2 hours before you go to sleep, and making sure that you have a cool and dark room in which to sleep. Remember, you are not alone. There are many of us that are having difficulty sleeping at this time. Be patient with yourself, and I promise you will sleep better. Thank you for listening. This is Dr. Julie Zweig, founder of Z Sleep and Wellness. If you'd like to learn more about sleep or have further questions, please visit my blog, which is in the link below. Thank you so much, and good night.